I tell my families that Alzheimer's is one of the most difficult diseases for the family to live with. We all experience death when we take our last breath, but with Alzheimer's, it is like the person has passed away because their mind is no longer there. Instead of finding peace with the death, Alzheimer's families have to experience this feeling of death daily because the mind may be gone, but the person is still there.
Now, if anybody was wondering, that was my mom. She's a hospice nurse. Now, where others may forget something and remember later on, Alzheimer's patients don't get that chance. Alzheimer's disease is a mental deterioration within an old individual's brain or middle-aged individual's brain that messes with their brain cells. Today, I'm going to talk to you about three major facets of Alzheimer's disease. In the first facet, I'm going to remind you about the causes and symptoms. And then I'm going to forget about that one and remind you about the effects on an individual's body. And third, I'm going to forget about everything I said before and remind you about the treatments for Alzheimer's disease. Now, first, reminding you about the causes. According to the Mayo Clinic staff, less than 5% of the time, Alzheimer's is caused by a genetic change that virtually guarantees you'll develop the disease. When scientists looked further into a microscope with Alzheimer's, they found two major hallmarks of this disease. One being called plaque and one being called a tangle. A plaque is a clump of protein that tangles up into the brain that destroys brain cells in many different ways. Although the brain cell death is unknown still in Alzheimer's disease, plaque being on the outside of the brain is a prime suspect. And next is tangles. Tangles requires what is called tie, and tie twists into tangles in the brain, causing failure and brain cell death. Now, those are just a few symptoms from the Mayo Clinic staff, but looking into a few more causes is you can develop Alzheimer's disease from age, genetics, or having Down syndrome, as well as a few major ones having past head trauma, high blood pressure, or high blood cholesterol, as well as smoking and exposure to secondhand smoking, and the lack of fruits and vegetables in your daily diet. Now, I'm beginning to lose my memory, so I'm going to refresh you on the symptoms of Alzheimer's. Again, according to the Mayo Clinic staff, people developing Alzheimer's, their symptoms tend to be memory loss and disorientation. They can begin to forget everyday objects, and they slowly begin to not remembering family members' names, as well as going to familiar places but forgetting where they're at. And another major one is when Alzheimer's patients are starting to develop this disease, they tend to wander around and look at unfamiliar things over and over again. So now that I forgot about facet 1, I'm going to move into facet 2 and remind you how Alzheimer's disease affects an individual's body. Now, according to my mom, being a hospice nurse for 7 years and taking care of Alzheimer's patients tend to have a great long-term memory, but a lot of them lose their short-term memory. So, for instance, they can remember something they did from back when they were a kid, but they can't remember what they ate for dinner yesterday. But then looking into Dr. Tina St. John, she talks about how the Alzheimer's disease affects 3 major body systems: the central nervous system, the digestive system, and the neuromuscular system. So first, affecting the central nervous system, it messes with the brain and the spinal cord, affecting memory and learning. And now in the later stage, they will develop where they lose their sense of self and the capacity to rationalize. Next, affecting the digestive system, it begins to affect their swallowing, and they have trouble eating without choking on anything. So a common death with the digestive system and Alzheimer's disease is pneumonia. Pneumonia, again, looks back at their swallowing difficulties and eating without choking. And it later on, when developing pneumonia, they can soon lose their sense of taste as well as interfering with their sense of smell. And lastly, it affects the neuromuscular system. In the earlier stages, they will begin to not be able to use their muscles properly, but then in the later stages, they will begin to not be able to walk, maintain great posture, or sit up in a chair stably and safely. Now, continuing looking back at the Mayo Clinic staff, People with Alzheimer's can also tend to forget their statements, forget family members' names, and so that affects them on their body because they're 1 minute they can say, okay, this is my daughter, her name's Tina, but then the next minute they say, okay, I don't know who this is, or I don't know what I ate yesterday, and they get very discouraged because they can't remember that. So lastly, that I forgot about everything I said before, I'm going to remind you about the treatments for the disease. According to Alzheimer's Association, there's many different medications and treatment methods that go with this disease. First, you can look into the medicines that deal with memory loss. First, you have Aricept that deals with all stages. Then Razidine that deals with mild to moderate. Then you have Namrata that helps with moderate to severe cases. Exelon that helps with mild to moderate. And finally, the newest one, Namzaric, that deals with more moderate to severe. All these medications can cause nausea and vomiting, as well as headaches, but they all help really well with this disease. Next, looking into the treatment methods and the medications for behavioral changes. When looking into an Alzheimer's patient and their behavioral changes, you want to avoid being confrontational with the patient. You want to allow them to have adequate rest, but not too much. Provide yourself with a security object, and you also want to acknowledge their request. Like if they say, okay, I want this, then give that to them so they don't get discouraged. And then lastly is you want to if they start acting different, you want to redirect their attention to something they may like. As far as medications go, they usually like to steer towards antidepressants, anxiety and restlessness meds, and antipsychotics. So for antidepressants, they like to use Zoloft and Trazodone. For anxiety and restlessness, the best one to use is Ativan. And finally, for the antipsychotics, they like to steer towards Haldol and Seroquel. And lastly, the doctors tend, before treating this, they like to look into the sleeping changes, methods, and medications for that. So a doctor usually says they want to maintain regular times for getting up, eating a meal, and going to bed. You want to encourage maybe regular daily exercise just so they can get up and get out there. Treat any pain they may have, and try to steer away from any television before they go to bed. Now, as far as medications go, they like to steer towards Trazodone, as well as a benzodiazepine such as lorazepam, or an older classical method, Haldol. So now that I completely forgot and lost my memory, I'm going to recap and share with you that in Facet 1, I reminded you about the causes and symptoms. I forgot about that, and in Facet 2, I reminded you about the effects on the individual's body. And lastly, forgetting about everything else I said, I reminded you about the treatments for the disease. Alzheimer's patients don't have it easy. They may not be perfect and they may not remember what other elders can do every day on their everyday life, but they still are special. To remind you just how special these patients are, I'm going to end my speech today with the hospice nurse in my family, my mom.
Alzheimer's patients deserve just as much attention as others. Just because the disease has robbed them of their minds doesn't mean that they can't still hear us talk or see us care for them.
Thank you.